there's a medical professional on board, please alert your flight attendant.
Dr. Danielle Ward here. Time for a story. So, as a physician, and even way back as a medical student, there's always been one thing that's on the back of my mind when I board an airplane. That's right, the in-flight medical emergency. There's always this hidden fear that you'll be the only physician on board when there's a medical emergency, and you'll be tasked with the decision of having to land a plane full of passengers who have somewhere to go, or do you keep it going? How do you save this life? It's a scary thing. And guess who recently experienced an in-flight medical emergency? Yep, this doc right here. So stick along with me as I share my story of how I made it through responding to an in-flight medical emergency. Spoiler alert, everything was all good in the end, but I'm going to share the story, how it went, and hopefully you guys will stick along for the ride. Okay, if you've been following along on my videos, then you know that I recently took a trip to Bora Bora for a women physicians retreat. But what I didn't tell you was during one of my many layovers, there was a call for a medical professional to respond to an in-flight emergency. Basically, I'm in my seat in the very back of the plane when I hear,
If there's a medical professional on board, please alert your flight attendant.
The good news is I knew I wasn't the only physician on board, because when I was boarding the plane, the flight attendant was like, wow, a lot of you are going to Bora Bora for a retreat. That's really awesome. And I remember seeing a couple of ladies she was talking to and waving to them. So I felt good knowing that I wasn't the only physician. But when the call was made, I rang my light for a couple of reasons. One, I was in the back of the plane. This was the domestic portion of my trip, so I wasn't first class. I hadn't had any drinks, and I figured that the ladies up front that I had waved to had probably been a few drinks and were having a good time, so I took one for the team. Second reason why I rang it is because this was not my final leg of the trip. I had 2 more layovers to go. Landing this plane was not an option. I still had an overnighter to get to Bora Bora. We were gonna land this plane. And then of course, the third reason is because I'm always happy to help my fellow human in need. So I ring the light and the flight attendant comes over and it's like, physician or nurse? I say physician, and immediately she's like, great, come on, and starts walking to the front. Now I have to stop here and acknowledge this portion because I was on a Delta Airlines flight, and they have been notorious in the past and recently for ignoring Black female physicians when they respond to a medical emergency. So a lot of us tend to just not even respond at this point because we're not acknowledged as physicians. They want to bombard us about credentials, or they just don't believe it, or they'll take a nurse or some other medical personnel over a physician. So I do want to give props to Delta Airlines for realizing that I was a physician, that there was a passenger in need, and immediately just saying, come on. Now, I do carry my medical license card on me, and I did show it to the flight attendant afterwards, as well as when I first graduated from medical school, I did have my medical credentials verified with Delta Airlines. So on all my boarding passes, it does say MD, despite the fact that I have told them I am a DO, but in their system, they just call us all MD for some reason. So that could be it. They probably knew I was already a physician from the logs, but either way, they didn't give me any grief about it, and they let me just come to help. So I walked up to the front of the plane, and on the way there, I did pass up one of the women who I waved at when I was boarding the plane, when they were talking about the Bora Bora retreat. So I was like, are you coming? And she's like, no, go for it. And I thought it was super odd because I'm like, you're here. But later found out that this particular woman was part of the travel representatives putting together our retreat and not actually a physician. It all made sense after the fact, but I look at it now and I laugh about it. But before I was like, huh, interesting. But I get to the front of the plane, and there are actually 2 other female physicians up there, which I thought was super cool. We asked each other the specialties. It turned out they were both orthopedic surgeons. When they asked me, by default, I say surgery, just from having done a general surgery year, and I still have general surgery rotations that I do here. So I just immediately say surgery without the plastics part. So everyone was like, great. But we encountered the patient standing by the restroom. This particular patient was experiencing shortness of breath and what they said was chest tightness. So immediately we all put on our physician hats. We placed the pulse oximeter on the patient to see what their oxygen levels were, and it actually read as 88, which is pretty low. But the patient was standing there in no acute distress, normal chest excursion, normal respiratory effort, was not struggling to breathe, talking to us normally. And one of the other physicians up there with me did end up putting the pulse ox on her finger, and it read as pretty low as 92, 93. So at this point, we knew that the pulse ox wasn't calibrated as such, but I went over to that patient. I asked them about their medical history. They did have a list of medications on them, and from those medications I could see that this particular patient did have asthma, had a history of anxiety. There was a service dog with the patient that helped in formulating the decision of what to do as well. One of the first things I did was I asked the flight attendant, do you guys have oxygen? Flight attendant was like, yes, sure. Brings out this big oxygen O2 cylinder and a mask. And so I'm like, do you have a nasal cannula? And can we calibrate this like 2, 3, 4 liters? No, they give you a cylinder, they give you a mask. Can't calibrate it, that's what you use. So we put this on the patient. I asked the patient when was the last time they took any medications. This patient was tachycardic, so what that means is their heart rate was pretty fast. But I found out the patient had just taken their inhaler and steroids, so that can be a cause of having a really fast heart rate. The patient had also just taken some anti-anxiety medications right before I walked up, so we wanted to make sure we gave those medications time to kick in. After we put the oxygen mask on the patient, we did recheck their oxygen. It did go up to 96%, which was good. The patient stated they were feeling better. Since there were 2 other physicians up front and I was in the very back, I went through everything with the patient. We did a full medical exam and all of that. But the other physician, I was like, do you want to stay with this patient and watch them? I'm in the back. You can grab me at any time. And that's what pretty much happened. Patient turned out to be okay. This was the last 2 hours of our trip. We made it there safely. And then once the plane landed, the paramedics came and got the patient off before everyone could get off the plane. We didn't have to make any crazy decisions about landing the plane. It wasn't too crazy. It was typical stuff that I would see in an urgent care setting, but still scary nonetheless to know that you have 2 hours to go and there is a patient in need and you want to make sure that you're doing the right thing. I should also mention that in addition to that, the patient was given an aspirin and other things. We did do all the medical things necessary. I know I'm glossing over it, but the patient was fine when we got off the plane. And even better, one of the ortho docs who helped with the medical emergency was actually going on the same Bora Bora retreat that I was going on. So I made a new buddy before I even got off the plane, and we ended up being able to hang out during our next layover. And then we had a great time on the Bora Bora retreat. Have a new buddy for life who we bonded with over an in-flight emergency. So that was pretty great. All right, education time. What are some common in-flight medical emergencies, and what do you do as a physician or medical personnel if you encounter an in-flight emergency? Well, what I've been using for years since I graduated medical school, like I said, this is always in the back of my head, is there's the Journal of the American Medical Association. There was a review that came out based on in-flight medical emergencies. And in that review, they went over the most common types of in-flight medical emergencies that might be encountered and things that should be done. For years, I had this in my phone. I'll have to find it. If I find it, I'll put the link below. And it was a really good review of what to do, just to give you a baseline in case, you're not in a field where you're actively managing patients all the time, like you could be a psychiatrist, like something where you're not treating common emergencies that you see. No shade to any specialties. The 3 most common types of medical emergencies that were listed in the article were syncope was one, and that's basically someone passing out, fainting. GI issues, someone who's nauseous, vomiting, and then respiratory distress was one of them. Other things that we worry about, of course, are like the MI, someone having a heart attack or a stroke. But I'll just briefly go through the common things and what you can do when you're on an airplane and someone is going through this. For the first one, syncope, when someone passes out, first thing you can do is you can lay them down flat. You want to elevate their legs. Airplanes do have a kit, which I found out responding, where they have things like glucose monitors and medications, and these have to be ordered by a physician, so that's why they want a physician to respond to these. But you can check the person's blood sugar, you can give them orange juice, raise their legs, have their head down, get that blood flow going, fan them out if they're overheated. So that's just very simple thing that you can do for that. GI issues, this is something that you'll likely see with people. If you're on flights from Vegas, you'll have a lot of people who are hungover, who are vomiting, nauseous. Number one thing you could do with these is Zofran. I have not responded to a medical emergency where someone was actively vomiting or sick, but one thing that I would do is give them antiemetic medication, and that will help them to feel less nauseous and to stop throwing up. You also want to give them water, put cold air on them. But it could be things like food poisoning and other things. You just never know. If someone has diarrhea, I want to say the airlines would have an anti-diarrhea medication, but as I've discovered, they have very basic things, or sometimes they don't have things at all. So it's just something to think about. And then for something like respiratory distress, oxygen, of course, they don't have the O2 nasal cannula. They have a mask, but you want to make sure you get that oxygen flowing right away. You want to review things with the patient, see if they have asthma, COPD, if there's something like anaphylaxis going on, they might be having an allergic reaction. You want to give them epinephrine. I would think that airplanes would have epinephrine because you need that for cardiac arrest as well. But you could always ask one of the fellow passengers if someone's carrying an EpiPen. I believe, I would say one person on every plane is probably carrying an EpiPen. But that's just something I would think about. I haven't had to respond to an emergency like that. And then for the really, really serious things like heart attack, stroke, I mean, obviously if it's serious, you're going to have to land the plane. There's no way around it. But on every flight, there is medical ground support. So you can get the flight attendants to call the ground support, and they can actually help coach you through it. So even if you're a little rusty or it's something that you're not familiar with, have them call ground support, have them coach you through what to do, and then you can still save that patient's life. And as a physician, you can still order the medications and get things rolling to help facilitate that. But look down in my comments when I post this. I will try to link to that article because it is a really good article on dealing with in-flight emergencies, and it'll just help you educate yourself. But that's pretty much the story of how my in-flight medical emergency going to Bora Bora went. I am so happy that the patient was okay and that it was not anything more serious, but I was prepared for anything. And I think that's the thing that's scary as a physician on a plane, is because you never know what could happen if someone's having a medical emergency, and then you have to go back and remember all of these things. So it is important to stay up on your medical knowledge despite whatever field you're in. Like I said, that article is a good one, but I'm just happy that it went off well. I was able to make it to my next layover without any issues, met up with a group of awesome women physicians. We had a great time. Unfortunately, on my subsequent layovers and coming back home, I did not have to deal with any medical emergencies. If you found this video useful, please hit that subscribe button. As always, thank you guys for watching. Let me know in the comments what you think about in-flight medical emergencies. Have you ever had to respond to one? What did you do in that situation? I'm interested to know, because this is still that scary part of traveling for me that most people don't even think about, that we as medical professionals think about. But I hope everyone watching this has an excellent week, and until next time.